Hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And I'm chatting today with Dr. Mickey Sperlich about her upcoming presentation titled Trauma-Informed Care in the Perinatal Period. Welcome, Mickey.
Well, thank you so much, Kristen. I'm glad to be here.
Thank you so much for taking the time and chatting with me about this very, very important topic. But before we dive into the presentation and the topic itself, could you please tell us a little bit about yourself and your professional journey and how you got interested in the topic?
Yes, my journey into this topic began really during my work as a midwife. I had a fairly long career as a midwife, working with women who, some of whom were survivors of sexual abuse or other adversity. I didn't in the beginning really know much about this and all these connections, but I really learned a lot from my clients about this topic, which really spurred me on to want to learn more. So that's how I got into trauma research, looking at the perinatal period specifically.
Good, thank
Um,
you.
yeah.
And yeah, I'm sorry, I didn't mean to cut you off there. I'm sure you have a
Oh,
little bit more to share.
oh. Well, I actually then started some independent research, which I will be talking about in our presentation. And then finally just kind of went all in on research and went back to school, got my PhD, and now I'm very focused on looking at trauma in the childbearing year.
Very good, thank you. And diving now into the topic itself, your presentation is called Trauma-Informed Care in the Perinatal Period. It's a very important topic, and many healthcare providers are aware of trauma in the perinatal period, and it's a very complex topic. So healthcare providers are dealing with the physical aspects of pregnancy and baby and mom and or pregnant person, and but the trauma, things that can come up induced by trauma in pregnancy, that's often a very daunting task for many healthcare providers. And often they feel that they are not adequately educated about it, or they're not specialized in it or specialist in this. What can you tell healthcare providers about it? What kind of pointers can you give them in short, without going too much into the topic itself for their presentation?
Sure, sure, sure. Um, I think one of the things that I would say right off the bat is that this is not something that we have to do alone. I think that bringing attention to mental health during the childbearing year, as well as sort of normal processes of prenatal services, is something that really speaks to this overall concept of integrated behavioral health um, with mental health care, and that we really need to be moving towards that. So that means that we don't have to do this alone, that there is help out there, but it means we need to be talking across disciplines um, and respecting and honoring that pregnancy is a real opportunity. It's not very often that you have young women, many of whom are survivors of abuse, who are accessing care on such a regular basis, right? And so
Hmm.
if we're not doing the kind of screening and assessment and referring that we need to do for women who do have problems related to past trauma, then we're really missing this opportunity that does exist. So that would be one thing I would say, is that we don't have to do this alone. There's really good opportunity for networking and working across disciplines.
Hmm.
Another thing that I would say really quick is that in the end, I don't think that trauma-informed care is really advocating for any kind of special care. Trauma-informed care is really very simply the way we all deserve to be treated, right? It's just that if we have survivors in our practice and we're not treating them in that way, they're very sensitive to that, and we can cause further damage, and we want to avoid that at all costs. So, um, yeah.
Absolutely. I agree with you 100%. And I like what you said right there about seeing this as an opportunity rather than, oh, how do we deal with this? And seeing this as like an overwhelming extra task. Would want to help these women, but instead of saying, okay, I don't have to do this alone, as you said there, reaching out across disciplines and seeing it as an opportunity, since we have these women coming in into care, at regular intervals for their prenatal care. As you mentioned, it often, it opens up a tremendous opportunity right there. And yeah, that's a very good point you made there, right there. Thank you for that. Now to my last question here. What, again, without giving too much away, would you like our delegates to take away from this presentation?
I would really like them to take away the importance of looking for referral streams close to them. So figuring out who are the allies out there in the systems that they're embedded in, who are trauma informed, who specialize in trauma specific treatments, who can be real sources of information, and also, of course, people that they can refer their women to who are struggling with post-traumatic sequela. So that would be, I guess, an overarching thing. If someone takes nothing else away from this, it's okay. I need to look within my own community and figure out where are the allies for doing this work.
So
That's
true.
pretty important.
Thank you so much, Miki, and thank you for taking the time to chatting with me today. I'm looking very much forward to your presentation, Trauma Informed Care in the Perinatal Period. And this presentation is part of the Trauma Informed Care lecture pack. For more information on this presentation and the Trauma Informed Care lecture pack, please visit www.goldperinatal.com. Thank you all for listening. Thank you again, Miki, for your time. Bye bye, everyone.